Good afternoon, everyone, and thank you for joining us today. My name is Chana Gassetis. I am the spokesperson for Boulder County Public Health. We're really glad you could make it today, and we hope that these regular COVID updates will give you the opportunity to hear more about COVID response in Boulder County specifically, and to ask questions that you may have. Today, you're going to be hearing from Jeff Zayach, the Executive Director for Boulder County Public Health, Indira Gujral, who is the Communicable Disease and Emergency Management Division Manager at Public Health, and from Dr. Mark King, who is the head of Boulder Community Health Infectious Disease Group. So I'm going to turn this over now to Mike Stratton, who will be moderating this discussion and give us some tips on how the webinar will proceed. Thanks, Mike.
Good afternoon, everyone. Thanks for joining us. I'm Mike Stratton with Boulder County Public Health. A few quick housekeeping rules on how things are going to work today. We will take questions at the end of the session after our three speakers. To do so, you'll see the Q&A thing at the bottom of the screen. Click on that, type your question in, and we will ask that for you. If you're on the phone, you can also raise your hand by dialing *9. And we will call on you then, and you use *6 to unmute yourself. Also, we are recording this. It's being broadcast as well on YouTube, on our YouTube channel. So please go watch there if you like, or send your friends and other folks who want to see what we've talked about tonight to that page. And I believe we also have closed captioning enabled for those who are on the Zoom call, so you can go into your personal settings and turn that on and off. And now I'm going to turn it over to Jeff Zayach, Executive Director of Boulder County Public Health.
Thanks, Mike, and welcome to all of you who are on the call today. For our interpreters, I will try to speak slowly, especially as I'm covering my slides. What I want to do today is take about 10 minutes, maybe a little bit more, to share what our data looks like in Boulder County, and then what we expect as we enter these next few weeks. Again, appreciate all of you that are tuning in today. What I'm going to do is share my screen. If you bear with me first, I need to be able to share. Somebody has to give me screen sharing.
Abby?
I should have just allowed you to do so. Can you see that option now?
Let's see. Yep, thank you. All right, if somebody can just confirm when that's up.
It's ready to go.
Thank you. So what I'll do is I'll cover our data. There's 3 measures at the state level that determine which category we are categorized in at the state level relative to controls around COVID spread. And the 3 measures I'm going to cover here, this is data from a day ago. So if you looked at these rates today, you would see that this was a little bit higher. So instead of 644.9 per 100,000 for the last 2 weeks, we would be at 670. So I just want to make sure people know this gets updated a couple times a day. But we are in the red for our incidence rate, which means that we are above 350. We have a high incidence rate of COVID. This is consistent across the entire state, as you can see on this map. And I'll talk more about that challenge a little bit later here. The next measure is our positivity rate, which is at 6.7%. This too has increased to 6.9%. So we are heading a little bit in the direction of increasing, which is not the direction that we want to head. Our third indicator is the number of days that we are currently decreasing or stable in hospital admissions. This has actually improved over the last day. We are currently at 9 days. And I'm going to show you what our actual admissions look like for Boulder County. This is a busy graph, and what I want to demonstrate here, though, is that this is the metro area, and it includes these counties up here. And this is the new case rates by county over a 7-day average. And if you look at this the red line is Boulder County. What I want to illustrate for folks is when we went through the challenge with the CU surge back in late August and early September, this was our peak. You can see that across the entire metro region, our peaks are much higher at this point. Our numbers have started to decline, but they are also starting to pop back up in a couple of these counties. So we have such high incidence rates and such high numbers that it makes us challenging for us to control this disease right now. More about that in a minute. This is our 5-day average of cases, and at 128.6 of a 5-day average of new cases, we do not have the ability to contact trace and do case investigation with this many cases. Contact tracing and case investigation is when we follow up with people who have been identified as positives, or they've been exposed to somebody who has been identified as a positive. And that's one of the primary ways that we can control this disease is through that mechanism. When we have numbers this high, not just here in Boulder County, but across the state, we are very challenged with being able to follow up with that many cases. So many of these contacts are via letter or other electronic means. And we're not able to do one-on-one contacts with that many cases. So that makes it difficult, again, for us to be able to control the disease. And that's when we have to move into larger community-wide approaches to control the disease beyond just doing case investigation. This is our 5-day rolling average, which shows a slightly downward trend right now. And we want that trend to continue. We hope to see that this trend continues down. The reason we track both the 5-day, which is what we're reporting here, but also the 14-day is what's on that state measure, is because the 5-day is a little more responsive. We can actually tell if things are changing more quickly when we look at the 5-day rolling average. This is our case rates by age group. You can see the age groups across the bottom of the graph. This big spike in the middle that goes outside the graph itself was the spike associated with the 18 to 22-year-olds, primarily associated with our students coming back in the fall. You can see that all of these cases are decreasing right now. This is a positive trend, which is great, with exception of our 75-plus-year-olds, which has increased and looks like it might be leveling off a little bit. And this you're going to see in our positivity data as well as in our death rate data that a lot of these folks are associated with long-term care facilities, and they're also our most vulnerable people in our community. This is the number of new cases across our municipalities over time since August 30th. And you can see that a large percentage back in September were associated with the city of Boulder. That's because of the university outbreak. We're now seeing that shift to a larger percentage in Longmont, and then Boulder, and then our remaining jurisdictions that you can see here. This is the number of residents that have reported testing positive or who are considered probable by race ethnicity. And the biggest thing I want to show here is what you see in orange is our Latinx population, and we know this is a unacceptable disparity at this point. We really are working hard to engage our Latinx community to help them problem solve with us to be able to figure out how we do better at being able to assure that we have the right access to services, testing, and resources that support all of our community members equally. And we will be continuing to work on this over the months to come. This is the number of tests that we are doing. And it says adequate testing being done. That's because our testing capacity is significant in Boulder County. We have 4 different testing sites. Those more than 4. If you look on our website, if you just search Boulder County COVID-19 and then testing, you'll see the testing locations that are available in our county. But we do have 4 different drive-up sites where people can get tested. And we do have adequate testing capacity, but what we're seeing at the statewide level is that we're only seeing 38% of our symptomatic or asymptomatic positives being detected. And that means, and plus our positivity rate is at 7.2%, which is above the 5%. That's really the best practice number to have. That means that we don't have enough people taking advantage of testing right now. We do have capacity for testing. We encourage everybody listening to please, whether you're symptomatic or asymptomatic, please go to those testing sites. It indicates which sites are free on our website and what those hours are. So please do take advantage of this testing. This demonstrates our hospitalizations in Boulder County. This is a good trend that we are in right now. Our hospitalizations are declining. One of the things we clearly hear from our hospitals is that the hospitals have gotten better, because you can see that Over here, we were much lower. I think our highest number was 68. We've been above the highest number of any time in this disease prior. Our hospitals have got much better at being able to treat patients in the hospitals. Our lengths of stay have shortened with hospitals. And this is a positive trend that we want to continue to see as we move forward. This is also the state's hospitalization rate. You can see that that is also on a downward trend. Again, we hope to see this continue, and we'll be watching for the rest of the week to see what kind of impact we have from Thanksgiving, and more about that in just 1 second. This is the number of deaths. Unfortunately, what we're seeing is an increased number of deaths here. These are people's mothers, fathers, sisters, brothers, grandparents. These are tragic. Any death in our community, and especially the number of deaths that we've seen in the last month and a half, just indicate the significance and seriousness of this disease. The graphs in orange are from our long-term care facilities. The vast majority of the deaths that we're seeing are from our long-term care facilities. And some of the challenges associated with that is asymptomatic staff that are bringing the virus into the facilities themselves. We've worked really hard with our facilities. They've all done incredible jobs, really putting in the type of prevention measures that are necessary, but we can't test every single person every single day. And one of the best hopes that we have that I'll talk about is the vaccine. And we already have contracts set up to make sure that our long-term care facilities, nursing homes will be able to get vaccine in the early priority. And this is a graph that shows hospitalizations. The green line is hospitalizations that are non-COVID. The red line is COVID hospitalizations, and the blue line is flu hospitalizations. And the good news is that flu is very low up until this point. We're seeing very few flu hospitalizations. We hope that continues. We thank every single one of you on this call who's gone out and got your flu shot, because we know that flu can hospitalize people, and we don't want to stress our hospital systems any more than they're already stressed. You can see that hospitalizations in general were high. So when we add COVID to that, it stresses our hospitals a little bit more. Dr. King is on the phone, and he will be talking about this more. But in general, we are seeing that our hospitals are challenged most at this point with staffing. That's what we're hearing across the state and regionally. This is the time at home, and I'm going to show you between this slide and our next slide. The time at home is actually increasing a little bit. It has significantly decreased, but it's starting to increase again, and that's a positive trend. This was historic 2019, where we saw time at home trends, so you can see much lower than where we've been in this disease progression. We want this to continue to climb. The more we can get this number to climb for time at home between now and when we get a handle on this disease, the better off we're going to be in terms of the spread of this disease. Just a few more slides, and I'll turn it over to Indira. I want to talk about this. This is a projection from the Colorado School of Public Health. And what this scenario looks at is right now there's what's called 71% transmission control. And just to give you a perspective, when we were in the stay-at-home order back in March and April, we were around 80% transmission control. That just means the amount of control that people had, or the social distancing that they were implementing to stay away from each other. So with a 71% transmission control, if we can maintain that throughout the winter holiday, our projections are this bottom line. And it shows that we are not going to exceed our hospitalizations, and it shows we won't exceed our ICU thresholds for surge. If we relax our transmission control and we don't stay at home and we do get into large gatherings, then this shows what those scenarios look like. In the scenario where there's a 30% lapse here, we actually exceed our ICU ability, and that puts greater pressure on our hospital systems, and extends the time that we need to focus on how we get a handle on this disease. That has direct impacts on businesses, schools, social emotional issues, as well as our quality of life and our economy. The challenges ahead: estimated 1 in 40 infectious people in the state. I want to really focus on this because this means that there's a lot of virus in our community. About 3 months ago, when we were towards the middle of the summer, our estimated rate of infection would probably be around 1 in 800. So we have a lot more people infected with this disease, which means there's a lot more opportunity for people to spread this disease. And that's exactly why we need to do the best we can to maintain physical distancing and not be in groups right now. We are watching what will happen with the impact of Thanksgiving. We should know that by the end of this week. The Colorado School of Public Health will run some updated modeling for us, and we'll have a better sense of what our holiday impact might look like. Our schools are depending upon us all working together, as are our businesses, to keep this virus controlled. We know that people have COVID-19 fatigue and that they're ready to move on from this, and we are too, but we all have to work together in order to be successful there. There is hope. I talked about these first two bullets. There is vaccine on the way. We are receiving our first vaccine shipment next week. We anticipate that. We do anticipate that we will receive vaccine shipments each week after that. We have a prioritization process for how vaccines will be distributed within our community. What people need to know is that it will start off slow and it will increase over time. We do have prioritizations for the highest risk folks. And then we will eventually get towards the early part of the summer to the largest portion of the population. We encourage all of you to please consider these vaccinations. Look up the data for yourselves. It'll become more and more available. We know that the more people that get vaccinated, the more chance we have of controlling the spread of this disease and getting back to a more new normal where students can be in classrooms, businesses can be operating, and we can have less deaths and less cases in our communities. And the last slide I have here is what you do matters. Please wear a face covering. It has been shown that face coverings are effective. And the more we wear face coverings, the more chance we have at controlling this disease. Maintain your distance, at least 6 feet between each other. If these two things happen, the disease cannot spread, and we can stop the disease. Please wash your hands and no gatherings. Last point I want to make is that this disease is preventable. We can prevent this disease from spreading. If we prevent this disease from spreading by doing these things, we don't have to have the policies that are currently in place right now that we know have significant impacts on, again, quality of life, behavioral health, mental health, our businesses, deaths in our community. Please, I urge you all to do what you can to help us get through this. The light's at the end of the tunnel. We only have a few more months we need to really focus on here, and we can move forward. Thank you all. I'm going to turn it over now to Dr. Indira Gujral, who is our Communicable Disease and Emergency Management Division Manager. Indira, the floor is yours. And I'll stop sharing.
Thank you, Jeff. Okay, let me try that again. Sorry, a new platform. Okay. Can you see the slides?
Yes, we can.
Okay, great. Thank you, Jeff. There is a light, and it's a very hopeful time for all of us. So I'm going to just share a little bit about the vaccine planning that we're doing in the county, and take some questions at the end if you have any. So I'm Indira Gujral. I'm the Division Manager for Communicable Disease and Emergency Management, and we have been working with our partners at the federal, state, and regional level. Information is flowing all of the time, and it changes every day. It's very rapid. And we're coordinating across the county. So we're working with our offices of emergency management, both in Longmont, the Boulder office, and also CU. For those of you who may not be aware about the vaccine life cycle, I just wanted to take a moment and explain a little bit about how vaccines are developed. So on the left, you have basic research and preclinical studies. And then when there is sufficient evidence to show that a vaccine may be a viable vaccine for effectiveness, it then moves into the green area, which is the clinical studies and clinical trials. So in phase 1, they're testing for safety, phase 2, effectiveness, and by phase 3, it's safety and effectiveness. And then all of that data that is produced by the pharmaceutical industries is then given to the Food and Drug Administration for a full review. And the FDA does a full review, and there are a bunch of really smart scientists who are reviewing and poring over that data to look at the effectiveness and the safety of the vaccine. And once they're done, it then goes to a group called the Advisory Committee on Immunization Practices, or ACIP. And this is a group of scientists who are independent from across the country. And this ACIP review is part of the CDC. And so what they do.
Indira, sorry to interrupt. Your notes are showing.
Oh, I don't know how to, let me see, display settings.
Can you close?
If you click on the three dots below your slide,
Does that help?
Below your slide. There you go.
Okay,
Perfect.
great. That helps me. It's actually bigger. I'm
Thank
getting. Okay, so after the FDA does their review, then ACIP, this independent group, does a review and they make recommendations. And then we proceed into phase 4. And phase 4 is monitoring for any kind of unexpected or adverse events. And this monitoring will be ongoing and continuous. So right now, Pfizer and Moderna are seeking the emergency use authorization. They have committed to produce 20 million vaccines each. And so that's a total of 40 million vaccines. And they hope to distribute between December and April of 2021. We are really excited because there are a lot of other vaccines that are also going through those clinical trials, and they are expected to produce emergency use or go for emergency use authorization in early 2021. And that includes the Johnson & Johnson vaccine and the AstraZeneca Oxford vaccine in February and March. So this slide just kind of explains a little bit of the complications with some of these vaccines. So the Pfizer vaccine, which we hope to receive soon, is a 2-dose vaccine, and it will be, the doses are administered 21 days apart. It requires an ultra cold freezer, which makes it a little challenging to make sure that you have the freezer capabilities. And then there's also a requirement about ordering around 975 doses at a minimum. This is different from the Moderna vaccine, which is 2 doses also, but is 28 days apart and is actually kept in a regular immunization freezer. And we hope to learn more about Moderna soon. And with Johnson & Johnson, they're looking at the effectiveness of potentially using 1 dose. That would be really great. Same with AstraZeneca. So the main thing to know is that this is a large campaign for our community and that the vaccine administration is complex. So the supply that we need for the entire population, I think Dr. Fauci had shared that he hopes that we have the supply for the whole United States by the second quarter of 2021. And also, so it's going to come out slowly. The frozen and ultra cold storage requirements are a little bit of a challenge, particularly for our hospital and our healthcare partners, and even for us in public health. It's important to remember that people will need a second dose. They will also need to make sure that they get the same vaccine. So you can't get one vaccine from one manufacturer and another from another manufacturer. They have to be from the same company. There's also public perception issues around basic vaccine safety and effectiveness. And among our community, we are hoping to be able to address vaccine hesitancy through a call center that's going to be set up by the state health department. There are policy issues. People are asking, do I have to get the vaccine? Is it mandatory or is it optional? And because of all of this, we want to make sure that we do robust community engagement and particularly focus on communities that may be more hesitant than others. This is a really nice illustration that shows the vaccine rollout based on the availability. So again, in phase 1, we will have limited doses available. We hope it's a short period of time as they trickle in, but then as you see, that rise increases over time, and we hope to have more vaccine availability by the time we get to phase 2. And in phase 2, we'll likely have sufficient supply to meet demand, and we'll be expanding beyond just the initial populations that we're going to focus on first. And by phase 3, we will definitely have sufficient supply, but it will also require people to uptake the vaccine. So be willing to take the vaccine. So the considerations are very significant because in the beginning, we will not have a sufficient number of doses for all people. And because of that constraint supply, we're going to have to prioritize within phases. And I'm going to share with you what that looks like in a second. And then all organizations will need to make decisions about making that vaccine optional or required. And just to give you a sense of how the vaccine is being allocated from the federal system, everything is being done based on US population. So we are a small state in Colorado. We represent almost 1.7% of the overall population. So we will receive vaccine, will be rolling out slowly in Colorado, and we will receive only half of our allocation at one time, and then they will send the other half of the allocation later. And it's very possible that we will see Pfizer and Moderna roll out at the same time. This is one of the most important slides that we can focus on, and this has to do with who will get the vaccine first. This was developed by the Governor's Medical Advisory Group, and this medical advisory group looked at all kinds of ethical considerations and also looking at risk of exposure, maybe due to occupation, and also, who has held the biggest burden of being impacted. So phase 1A is critical workforce. This includes our inpatient healthcare workers, and it also includes those who are working at assisted living facilities. So the staff who are employed in assisted living, long-term care facilities, who may be unintentionally or asymptomatically bringing the virus into those facilities. It also includes the outpatient healthcare workers. So these are individuals that in private providers in smaller settings, and includes home health workers and outpatient pharmacists. The focus on 1A is really to start with the hospitals and making sure that the hospitals are set up for success in getting their staff vaccinated first. In 1B, the critical workforce here is your first responder group. These are your fighter fighters, your law enforcement, your emergency individuals that respond, your ambulance drivers, paramedics. Also includes correctional workers and public health personnel. And by 1C, what we see is the highest risk individuals. And these are residents or patients of assisted living, long-term care, and nursing home facilities. So these residents, the good news is that these residents are going to be taken care of by a contract that the US government has done with CVS and Walgreens, in which CVS and Walgreens will actually go into these facilities and they will vaccinate those residents. And that's a good thing because it takes the burden off of our public health and our hospital institutions in getting these important people vaccinated. By phase 2A, we'll have support to hopefully have support. There's going to be 12 national pharmacies that will come online, and they also have these federal contracts to administer vaccines to individuals who are living in congregate settings and those in the essential worker category. And those include people who have direct interaction with the public. So people who work at grocery stores, teachers, people who work in childcare, all of the key essential workers that we need in our lives to get us back to normal. In 2B is our high-risk individuals, and these include individuals who are 65 and older, and those with chronic conditions, and also individuals who may have participated in the COVID vaccine trials and received a placebo. By phase 3, you'll see the general public will be opened up. So one thing to consider here is what we don't see on this phase distribution approach is pregnant women and also children. And that's because we're learning more, and some of them have not been included in the trials. So we hope to see more trials that occur among children, and we hope to see what the results look like for pregnant women. So the distribution for hospitals and critical employees, all of this is going to be handled in this phase 1 approach. And our plan includes to make sure that the hospitals are all enrolled and then start working in that outpatient healthcare worker setting. We have already started to meet with our critical workforce, which is our first responders, and we're initiating those planning activities with them. And then again, those residents in care facilities will be taken care of by those CVS and Walgreens strike teams that will go in and vaccinate those residents. By phase 2 and phase 3, we're really going to leverage those 12 national pharmacies chains that are going to come online and have the vaccines available. And that will really help to ensure that high-risk individuals and the general public have that access. We will be doing some strike team approaches for residents of congregate settings and essential frontline workers. So this is this is the new website that launched, I think today or yesterday, where you can learn more about vaccine development and planning from the state level. And we know that the call center is going to be set up soon, and we're really excited about that because that will give people and anyone in the community the opportunity to be able to to have a phone call with someone in the healthcare setting that will answer questions around vaccines, and so to ensure that all of their questions are answered before they get vaccinated. So again, just to reiterate what Jeff said, it's important for all of us to get the vaccine, and this will help get our businesses and our schools back to normal and open us up back again. Thank you.
Indira, can you turn it over to Mark?
Yes, I'm sorry. Mr. Mark King, Dr. Mark King has been a real ally for us at Boulder County Public Health, and it's my pleasure to introduce him and to share his experience with Boulder Community Hospital. Thank you.
Thanks, Indira. I'm just going to make sure everyone can hear me, that my microphone's working.
Yes, you sound great.
Okay, thanks for having me today. The county, so my name is Mark King. I'm an infectious disease physician at Boulder Community Health. I work on a team of 3 other infectious disease physicians, as well as a nurse practitioner. And that team has really been critical to care of COVID associated with Boulder Community Health, as well as a much broader team that encompasses really the entirety of our hospital and healthcare system operations. So there's a lot of people really working tirelessly to try to ensure the safety of our community and to make sure patients that do get sick with COVID-19, that we're able to care for them and hopefully able to get them through their illness to live another day at the end of this. I was asked to touch on 3 different topics, and the first topic was, what is the capacity of Boulder Community Health and how do we deal with COVID-19? The second was, how do we work with other hospitals, the health department, and what goes into surge planning for circumstances that we witnessed in November when we just went through a surge of COVID-19 in Boulder County. And the last thing is, what is the impact of behavior on driving the pandemic? And so I will cover those 3 topics here briefly. So in terms of how does BCH deal with COVID-19, the first thing I would say is there's been an enormous amount of planning and time that's gone into managing, taking care of COVID-19 patients and preparing for significantly larger number of patients than we normally care for at any given point in time. We're fortunate to have built upon experience related to the H1N1 pandemic and also from Ebola to have a lot of that sort of groundwork already laid. But there's an enormous amount of work that went in trying to make sure we do this the best way we can. Things that are involved in that sort of planning include personal protective equipment for our healthcare workers. And so early on in this pandemic, you're all aware that we really struggled to access personal protective equipment for our healthcare workers, things like surgical masks and N95 masks and gowns that protect us in the course of our work. We've made a lot of progress since early March in terms of acquiring additional personal protective equipment, and we have adequate supplies so that we can keep our staff safe in caring for patients with COVID-19. We've had time over the last several months to learn more about what treatments are effective and how to utilize them more effectively, ranging from how do we provide patients with oxygen all the way to how do we use new medications such as the antiviral drug remdesivir, and how do we include things like steroids. So we've adopted and adapted our treatment protocols over time to make sure that we're giving patients the state-of-the-art best treatment that we think is available for COVID-19. We've also spent a lot of time planning for what to do with a large influx of patients that's not what we is well above the number we normally care for. And so we have plans in place to expand our capacity pretty significantly, where we can care for patients in locations that are not typically used for patient care. November was a long month and a busy month for us. We were operating at a pretty full hospital most of the month. As most of Colorado has been seeing, we had a big surge, and the graphs that Jeff showed really demonstrate that the numbers of patients in the hospital over the course of November was almost twice what we experienced in April. And so it really does put a stress on the healthcare system. We anticipate that because of Thanksgiving travel, we're going to see another surge that is likely to occur within the next week to 2 weeks. And that's going to be, as Dr. Fauci has called it, a surge upon a surge. And so even though our numbers are fortunately starting to come down a little bit over the last week, we're still going to be starting this next surge at a much higher level, which has potential to stress the healthcare system even further. And so we're going to have to be carefully watching as that unfolds over the next couple of weeks. We look at the test positivity rate and the case numbers because those typically go up first. And then you see hospitalizations go up next, and then you see deaths follow last. And so we're going to be carefully watching all of those pieces of data over the next 1 to 2 weeks. The good news is we've been able to provide all of the standard patient care that we normally provide, in addition to the care we're providing for COVID-19 throughout the pandemic. It's challenging, and we have to adapt and do things differently than we've done in the past, but we certainly still are able to provide all the care that people in the community of Boulder require in a hospital setting or in an outpatient setting. We have protective protocols in place to keep patients and staff safe. So if you need health care, early in the pandemic, we learned that the patients weren't seeking healthcare because they were afraid of coming to the doctor's office or to the hospital. And we had excessive deaths across the country from things like heart attacks and stroke. Hospitals are a safe place to come to receive care. We have more safety protocols than anywhere else. And so if you need care, please don't delay it because if you delay your care, you could end up sicker in the end or even have a higher risk of death. The surge that we're talking about, though, does pose a risk to these sorts of care being significantly more challenging. And so as I talk about behavior at the end here, it's critical that we have our community helping prevent our hospitals from becoming so crowded or so busy that it's harder to care for people when we do have a toolbox for preventing this disease right now. And so your efforts go a long way to ensuring that our community has ready access to healthcare, which we will continue to strive to maintain. And I think we will be able to maintain, but we certainly need to have cooperation from the community standpoint. Jeff pointed out the importance of testing. In addition to the community testing, we do have testing available here in the parking garage across from Boulder Community Health. You can self-refer if you feel the need to be tested because you're sick or you have other reasons you've been exposed to someone with disease or you've traveled recently and need to be tested. The final part about preparations and how to deal with COVID-19 is vaccination. And so this is very exciting that we do have some glimmer of hope with vaccination on the immediate horizon. And so we're doing a lot of planning at BCH in conjunction with our partners at the county and a health department, to begin vaccinating our healthcare workers. And we hope to be doing this within the next 2 weeks. We do have the capacity of BCH to store these vaccines that require ultra cold storage. And so the Pfizer vaccine is anticipated to be the vaccine that we will initially vaccinate our healthcare workers with. When we see these surges, the other impact that occurs at hospitals is we have very large challenges with staffing. If we have more disease in our community, that means our healthcare workers have a higher risk of being exposed outside in their normal lives, or their children are exposed to the virus, or they get sick with the virus. And so we lose staff to both COVID infection or because they're quarantined related to being exposed to COVID. And so that's really an enormous challenge for hospitals across the state and country if COVID-19 really continues to climb in our community, because it will affect people in the healthcare community as well. I'm going to shift now to what do we do working with other hospitals. And so throughout the COVID-19 pandemic, collaboration in the medical world has never been higher. And people have shared so many things that we typically don't share in medicine to ensure that we can provide the best care. And that collaboration includes across health systems, across government levels, across public health levels, with the goal of making sure we ensure the safety and best care for our community. In Boulder, we have a team that's called the CIDR team, which stands for the Community Infectious Disease Emergency Response Team. That team came into existence around the time of Ebola several years ago, but has been maintained. And that group meets weekly and is led by the county health department to connect all the hospitals across Boulder County to understand who has adequate supplies of protective equipment, who has the ability to take care of patients if one hospital is very full. Are we getting access to the supplies we need and the medications we need? And we work as a collaborative group to inform each other and to make sure that we try to make Boulder County remain a very functional medical community. There's also a statewide transfer system within Colorado, and so we participate in that as well. And so if one system is overburdened and another system can help out, there are mechanisms in place through the state to help ensure that patients could get care outside their community if another community was able to provide it. The last thing I want to talk about is the impact of behavior on the pandemic. And human behavior is driving the pandemic. We do have a toolbox right now to deal with minimizing this disease. And that toolbox includes masking, social distancing, and maintaining hand hygiene. These are really not a very onerous task for us to do, even though we'd all like to be at a point where we no longer need to do them. But that toolbox is the key to us minimizing the impact and the spread of this disease in our community. And as both Indira and Jeff said, there's hope. And so we just have to hang on a little bit longer. We have a vaccine that really can change the tide of how this pandemic is occurring and allow us to start thinking about getting back to a more normal way of life. I really urge everyone during that last bit, it's going to be really hard, but we can prevent probably hundreds of thousands of deaths across our country if we simply use masks and social distancing. Those efforts will make it so much more successful at the end of the day when we have a vaccine available that we've minimized preventable deaths. I was asked to sort of comment on, as a healthcare worker, how do we feel when we see people that don't want to wear a mask or people in large gatherings, and does it make you angry? How does it make you feel? And throughout the pandemic, I've sort of gone back to a quote, a lyric from a Jack Johnson song, who's a musician. And the lyric is, why don't the newscasters cry when they read about people who die? And I think the bottom line is here, we have to think about how sad this should make us all feel. 1.5 million people across the world have died of COVID-19. 286,000 people have died in the United States, and 2,700 people have died in Colorado, of which 140 of those live in Boulder. So that's the feeling I get, is a deep sadness that we have all these deaths that are in many instances preventable, and we have a way to prevent them by just adopting some simple behaviors. So as I close here, I just say, I really encourage you to wear a mask. And when I think about putting my mask on, when I'm at work or when I'm not at work, I think about my mask equals saving a life. That life could be my own. That life could be my neighbor's. That life could be someone's grandparents. And so whatever I do may affect someone 10 dominoes downstream from me. So even if you're not worried about getting COVID-19, think about if you get COVID-19 and it leads to someone else getting COVID-19, who then gives it to someone else and they die. And so I think we all have a real responsibility to think about our neighbors and our community and a simple way to protect them. So please wear a mask, save a life, social distance. This holiday season, I would really discourage you from traveling. It's a very high risk process to travel. Going home to see family, we all want to go see family, but in going to see our family, we're probably not doing them a favor in any way. We're actually posing a risk to them because we could take COVID with us and pass it along to our loved ones who could get sick and even could die. Thank you.
Thank you, Dr. King. Lots of great messages there. We know we're a little bit short on time, but we're going to try to get to a few questions here. Let me tell you what we need to do to make that happen. You'll see in the bottom of the screen the Q&A button. Click on that, type your question in. We will get to a couple of them here before we have to sign off. We'll see if we can stay a bit longer, but we will get to all the questions that are typed in and put them on our web page, excuse me, on the COVID-19 update page, so you can look for your questions there. Let me start with the first couple here, see what we can get through. We have a question from Laura that says, if virus numbers are high in Boulder County prior to CU's spring semester, will you allow the dorms on campus to open?
Trina, can you answer that?
Sure. Yeah, sorry, my mute was not working. So under the state's dial order, as long as we are in level red, almost all of the University of Colorado must be remote. There is small exception for med school students who must perform labs in order to meet their requirements and feed that critical infrastructure pipeline. But otherwise, as long as we're in level red, higher education must be remote.
Trina, can you tell people who you are?
Sorry, I'm Trina Ruland with Boulder County Public Health. I'm the attorney for Boulder County Public Health.
Thank you.
Thank you, Trina. Here's a vaccine question. We have quite a few here. I'd rather not go to CVS for the vaccine. Will I be able to get vaccines from my doctor?
Yes, this Indira, that is the goal, is to make it widely available both through the pharmacies and also through your providers.
Thank you. Indira, I got another quick one here for you. Can we choose which vaccine we will get?
That's a really good question. At this time, you know, the Pfizer vaccine will be rolling out first, and then the Moderna. And then we'll see these other vaccine manufacturers bring theirs online as well. So that would be a conversation you'd want to have with your provider.
Okay, thank you. Let's see, we've got a question about the web page. Asking from Alex, we don't show the antibody test numbers while that's on the CDPHE page. Is that possible to add that? And also, where do the CDPHE antibody test numbers come from? Is this just a random test? Is this people who go in and ask to be tested? Is this people in the hospital? Where do these numbers come from? Do we know that?
Dr. Urbina, can you, or somebody, if they could address that?
I was going to have Dr. Urbina answer that because that's a really good question. And he's our medical officer.
It's Chris Urbina here, medical officer of the health department. It's only required to report to the state at this level because we don't know all the testing on all the labs that the providers are required to report that to us. So that's why we don't have it on our website. We would have incomplete data because it's not required to be reported.
Okay, there you go. Here's another question about tests. How often should an asymptomatic elder living at home and taking good precautions go get a COVID test?
I'll take that. Chris Rubina here. If they have no exposure and the people they don't have contact with don't have exposure outside the facility, there's no reason to get a test, unless, of course, they develop symptoms and they have contact with somebif So I think if that female elder can practice safe practices at home, and everybody who comes into her facility, to her house, can do that as well, then I think she's relatively safe, unless her symptoms or conditions change. And then she should probably consult her health provider to decide whether or not she should be tested.
And I know we are at past 4:30, so we may be losing some folks here, but we'll see if we can't go for another 5 or 10 minutes here, so you can stay on the line. Here's a question. My office is not being cool about working from home. What can I say to help them to understand how important it is to stay home and how easy it is for us to get, for all to work from home in an office setting? Can I get fired for refusing to work in an office during the winter?
I can take this one. I'm sorry to hear that you're having frustrations with your employer. There are a number of things at play here. First of all, no member of the vulnerable population can be compelled to work under CDPHE's public health order. In addition to that, there are restrictions under the public health order as to how many people may be in an office-based setting at any one time. If you feel that your employer is violating that, we strongly recommend that you contact Boulder County Public Health and report any such violation. You can do that on the website. We can put the information in the chat. And finally, as to your specific situation, there are a number of legal resources available to perhaps help you navigate this. The Boulder County Bar Association has a free legal aid clinic designed specifically to help folks with COVID-related employment issues. And I can put that information in the chat as well.
Thank you, Trina. There's a question here from Susan that actually I can answer. It says, why is data only updated twice a week on the Boulder County data website when the daily camera has that every day? Actually, we do update that website every day with the numbers that the camera uses. They pull it right off the website, so that's where that's coming from. We update the graphs twice a week because there's quite a work that goes into that. But yes, you could go look at the page any day after 3:30 or so, and you can see what the new numbers are. Here's another vaccine question. With the storage challenges of the Pfizer and Moderna vaccines, is there a strategy to ensure that no vaccine doses go to waste?
Yes, that is absolutely a good question. We are encouraging all hospitals, outpatient healthcare settings, including all of our 1B critical workforce, to have a strong vaccination plan in place so that no doses go to waste. It's unlike a flu clinic where you can put the flu vaccine back into the storage facility. You won't be able to do that, particularly with the Pfizer vaccine. Once you dilute it, you have a certain window of time to administer it. So we will be working very closely with our partners in the healthcare settings to make sure that all doses are administered.
Thank you, Indira. Why don't we get to one more vaccine question here? Do we know if the COVID vaccine will be mandatory for school admission for the 21-22 school year? What do we expect on that?
At this time, I would not expect that because the clinical trials have not included children. So we should be looking for more information happening through the spring. And as we get more information, there'll be more guidance. But for the most part, I don't see that at this time.
Okay, thank you. We have a question here. Let me try to paraphrase it a little bit. It says, we've mentioned cancer patients in the same group as those aged 65 and over and others that have health conditions. I had surgery for cancer. Currently, I have no signs of cancer. If I go in for another checkup, do I qualify under these rules? How will that work? What exactly makes me qualify as having comorbidities or other issues that may move me up to the top of the list?
So at this time, we're learning more information about that phase 2 rollout. So we'll have more information on that. But the good news is that the vaccine trials did include individuals who are in that immunocompromised status, and it was very successful. So that's really exciting news for you.
Okay, we do have a question about the schools and asking about, do schools contribute to community spread when they're open for classes? We know we said that's not the case. Could we have someone expand on that just a bit? Are in-person schools causing community spread?
Jeff, do you want to talk a little bit about this? Because you've been working really closely with the school districts. Or Chris or Bina?
If Jeff left, I'll go ahead and try to tackle this question. At this point, we don't see significant spread in the schools. Obviously, most of them are not open now. They're all remote. But we saw a slight increase in all the age groups. And that's because more kids were being out there and more kids were being tested. But at this point, because of the safe standards that the schools had in place, there was not much in the school spread. Most of the spread that was brought in to the schools from the outside by contact with other kids. But I think there's still more to come. Not all the kids were tested, not all the kids were symptomatic. But at this point, we don't see significant spread within the schools.
Okay, thank you. And that's all the time we have. We thank everyone who was able to stay 8 minutes late. Very much appreciate that. We will answer these other questions that we received on the website, so please check that out.